Good morning. I'm Dina Diorio, Mecklenburg County Manager, and I'm joined today by Gibbie Harris, our Public Health Director. Our American Sign Language interpreter today is Meg Tucker, and as always, today's virtual press conference is closed captioned for the hearing impaired. I have just a few items that I want to go through this morning before I turn the podium over to Gibbie. Wanted to remind people that the Board of County Commissioners task force, COVID task force on recovery is still open for applicants. The deadline is today at 5 p.m. We've had a considerable amount of interest. We've had almost 60 community representatives apply to be on the task force, and the board will start reviewing those applications at their meeting on Tuesday afternoon. So again, if you're interested in participating, today 5 p.m. is the deadline. You can go on our website, mecnc.gov, and you can fill out an application there and attach your resume as well. So looking forward to getting as many applicants as possible. On Tuesday evening, the board approved staff moving forward with distributing a portion of our coronavirus relief funding that we received from the federal government. They approved about $8.1 million in funding for a variety of different categories. So we will be moving forward with $1.5 million for utility and rental assistance, $1 million for food security. We will be spending $1 million on face coverings for the community, and we will determine how the best way is for us to distribute those for those that are unable to get them. $1 million for support to seniors in our community. $500,000 to do community engagement and marketing for various constituencies in our community, and $300,000 to expand senior nutrition services in the community. In addition to that, they also approved $2.8 million for support to our 6 towns. We will be able to reimburse our 6 towns for expenses incurred for COVID-19 to date, as well as be able to support them through December 30th when those funds need to be expended. The board also approved $1.3 million for nonprofits in our towns, so Ada Jenkins, Pineville Neighbors Place, Matthews Help Center, and Servant's Heart of Mint Hill will all receive funding from the coronavirus relief funding. So there is still additional money available that we'll continue to push out. We want to get these funds out to the community as quickly as we can. In terms of face coverings, there's been a lot of conversation about that here in Mecklenburg County, as well as across the state, as well as across the country. At the board meeting on Tuesday, the Board of County Commissioners directed me and staff to come back to them on July 7th with a recommendation on how they should proceed with either requiring face coverings in Mecklenburg County or not. As we've talked about before, we would like the city and the 6 towns to join us with whatever recommendation we come up with. So we continue to have those conversations with the municipalities and our healthcare systems to determine what the best recommendation will be for Mecklenburg County. So you'll hear more about that as we move forward. But again, the message is and continues to be that if you wear a face covering, you will do a lot to prevent spread of COVID-19 in Mecklenburg County. So again, we encourage people to do that every opportunity they can. And finally, we are continuing to work on our Welcome Back Mecklenburg planning. We will be reopening county offices to employees and customers sometime in July. Those plans are still being developed, and we will be briefing the Board of County Commissioners on Tuesday with our preliminary plans and the requirements and what that will look like, as well as what our plans are to communicate that to the community at large. So we are planning for that and hope to have some additional information very soon. So that's all I have this morning, and with that, I will turn the podium over to Gibbie. Thank you.
Good morning. So I have a few things that I want to talk to you about today. The first being just our regular data update. As of 11 o'clock this morning, we have 7,850 confirmed cases of COVID-19 in Mecklenburg County since the beginning of the pandemic. We have 136 deaths and 21 congregate living facilities that are currently in outbreak status. That status, the requirement for outbreak status has changed. The state has changed it from 2 to 1 case in any congregate care facility. So as soon as one case is recognized in a congregate living facility. We are working with them to get everyone in that facility as well as staff tested and then preparing them from being able to deal with the outbreak status. The number of positive cases continues to increase in Mecklenburg County, especially as we continue to try to increase testing. Our trends have continued to move in the direction that is not the direction that we want them to go in. So our positivity rate is over the past 14 days has been 10.6%, which is an increase. Our hospitalizations, we've averaged 118 individuals in the hospital over the past week. That is an increase for us as well. And our social distancing is almost at baseline where we were before we started with the stay-at-home order. I did want to talk a little bit about our data because there's been some questions about how accurate it is and whether we are overestimating or underestimating with our data. We receive every positive test that is conducted here in Mecklenburg County, regardless of the testing site or the testing entity. The state mandates that reporting. And so anybody, whether it's a lab or an urgent care or the hospital systems, whoever it happens to be, is required to report those positive tests to us and to the state lab. So the data that we present every week or twice a week includes every positive test that is done in Mecklenburg County. Where there may be some confusion is the state does not mandate at this point in time that negative tests are reported. So we do not receive the negative tests that are completed by a number of those facilities. At this point in time, the only negative testing that we receive that data on is for the two hospital systems, Atrium and Novant. But I will say that they conduct most of the tests in Mecklenburg County. They conduct over 75% of all tests that are done in Mecklenburg County at this point. So we are using their negative data as well as their positive data to develop our positivity rate. So we are comfortable with that data, and the fact that they conduct more than 75%, we believe that that really does provide us with good trend data in Mecklenburg County. We're continuing to work with the state and with some of the partners in the community to try to get good data on negative tests from some of the other testing sites. We'll continue to work on that, but there are challenges. Some of those sites report electronically, some of them still report by paper. And we are not going to report data if it is not accurate, if it has not been cleaned, and if we're not comfortable making sure that it is complete. So right now, we will continue to report our positivity rate based on the data provided to us from Atrium and Novant, which includes all of their negatives and all of their positives. The other positives are not included in determining that positivity rate. I want to talk about testing just a little bit. We've talked a lot over the past week about the increased need for testing and the expectations from the state and the federal government that we increase testing. We're working with lots of different partners on this. The Division of Public Health, we're having conversations with them on a daily basis. Both of our healthcare systems are involved in this. Both of our FQHCs, C.W. Williams and Charlotte Community Health Center, are working with us. Our testing laboratories, and some of the private entities that are providing tests. The issue for us at this point is capacity. Most of these entities are testing at capacity at this point in time. The federal government and the state government are providing some additional supplies. It's more about having the bodies present to be able to do the testing. So we're continuing to work on that. Right now, we're averaging around 2,500 tests a day in Mecklenburg County. We will have an opportunity for expanded testing next weekend on June 27th and 28th. We are working with Mako Laboratories to offer drive-through mobile testing at the Valerie C. Woodard Complex at 3205 Freedom Drive. We are doing this in collaboration with the General State Baptist Convention and their local faith partners. The testing will be available from 9 a.m. to 3 p.m. on both days. and that will be available to anyone who meets the following criteria: anyone who's experiencing COVID-like symptoms, anyone who has been in close contact of a confirmed COVID-19 case, works in a congregate living site, or is a first responder or other high-risk setting, and anyone who has attended a large gathering or a protest recently. No appointment is required, but tests are limited. We'll be able to do about 1,000 tests a day. This will be mostly drive-through, but we are accommodating walk-up testing. What you need to bring for that testing will be an ID of some sort, something with your name on it. If you have insurance, please bring your insurance card, but there will be no cost for the tests that are done on those 2 days. There'll be more specific information on our county website, and we'll be working with our community partners to get this information out broadly throughout the county. And lastly, I want to talk a bit about prevention. I've said before that we will not test our way out of this pandemic. There is still no cure, and there is no vaccine. We do have evidence, though, that suggests that cloth face coverings reduce the risk of spreading the virus, more than no covering, definitely, and particularly when we all wear them. There is some data that is coming out of a couple of cities that had early protests, specifically Minneapolis, where they worked actively to get masks out to the people who were protesting, and have also done some significant testing in those communities for those involved in protests. What they found is a low positivity rate among those who were involved in the protests. They're seeing the same thing in Seattle and in Boston. What this is telling us at this point in time is that we believe there appears to be a way to prevent these types of gatherings from being a hot spot for us, but the key is wearing your mask and being outside. Outside diffuses what's in the air. Wearing the mask prevents you from being exposed and prevents you from exposing others. So again, this data is showing us that there is good reason for all of us to be wearing masks every time we go out of our house. But I do want to state that there is no substitute for social distancing and hand washing. It's the collective work of these three things working together that are going to help us slow the spread of this virus. We do know that our stay-at-home orders have been effective tools in slowing the spread, but we also know that they're not a long-term solution. They do not stop the virus from spreading, they just slow it down. So at this point in time, we need to be careful about how we move forward with opening things up further. We need to make sure that people are doing what they need to do. Regardless of a stay-at-home order or not, the key prevention tools are what's most important. You need the physical distance, you need a cloth face covering, and you need good hand hygiene. Thank you. We'll be happy to take questions now.
Gibbie, this is Brett Jensen with WBT. I'm just curious about the nursing homes. Why are the nursing homes death rates so high? North Carolina has one of the highest rates in the country for nursing home outbreaks. What is North Carolina not doing that other states are?
That's a very good question. I think one of the biggest challenge we have with our nursing homes at this point in time is there are individuals who come in and out of those nursing homes every day. And these are the individuals that work there. They come back out into our community, into their homes where we know we have community spread. I believe that we have not been doing enough testing with those individuals, and we are ramping that up now, unfortunately, not soon enough. And we also recognize that these individuals quite often work in numerous facilities, so it's not just going in and out of one facility. So we are looking at expanding our testing while we're still working with those facilities to make them as safe as we can for the residents that are there.
Hey, Gibbie. This is Bill McGinty from WCNC. My question is in regards to health inspections at restaurants. Are there any new protocols going into effect because of COVID-19, and will restaurant workers in the kitchens be required to wear masks?
So there are recommendations that have come from environmental health at the state level about how we work with restaurants as we're doing inspections and the things that we're requiring of them. So there's a combination of things here. There's the requirements from the environmental health side of things. Most of those are in statute and cannot be changed because of that. Then there are the requirements that are coming down through the governor's order, and we're working with restaurants to implement those requirements. We are asking that those who work at restaurants wear masks, but we recognize that at this point that is not a requirement.
Hey, Gibbie, it's Allison Kuznets from the Charlotte Observer. Could you talk about if there are any age groups or any other communities in the population that are contributing to increases in cases recently, especially among the deaths we're seeing among younger adults?
So we do know from the beginning in Mecklenburg County that the majority of our cases have been in 20 to 59-year-olds. So that's where most of our cases are. I do believe we've been fairly lucky in Mecklenburg County in that our death rate has remained fairly low. But we are starting to see individuals who are younger, who are becoming infected, and several have lost their lives. It's still a small number in terms of the total number of deaths that we've had in Mecklenburg County, but it is of concern. And the point that I want to reinforce is that independent of your age, you are still at risk for COVID, and the disease can be difficult regardless of whether you have a pre-existing condition or not. So everyone needs to take this seriously.
Gibbie, this is Eric Spanberg at the Charlotte Business Journal. I'm just wondering what you think in terms of, you mentioned being cautious with opening back up. So when you see the legislature passing laws to reopen bars and gyms, and you know the governor has his decision to make next week, what do you think would be appropriate for Mecklenburg County in terms of the possible business expansion of what's allowed to be open?
We are waiting to hear what the governor has to say about this. We've been having conversations with the state about it as well. My concern at this point is not everyone is being compliant with phase 2. And if we continue to expand, I'm concerned about the message that that gives to our community. We need everyone to work with us on this so that we can continue to expand. And the more we have compliance with the rules that have been put into place, as I mentioned earlier, those are the things that are helping us slow down the spread of this infection. I think the sooner we can open things up. So I'm watching our data. It's not going in the right direction.
Hi, Gibbie. This is Robin Kennedy with Fox 46. Some restaurants have had workers test positive for COVID-19 and they've closed voluntarily. Are you recommending that if someone does test positive at a restaurant that they close?
No, we're not making that recommendation. When we recognize that we have an employee in a restaurant who's tested positive, we work with that restaurant to make sure that they are doing what they need to do to protect the rest of the staff, if that staff needs to quarantine based on exposure, and we're notifying any clients that we might need to based on potential exposure. But we are not making specific recommendations about closure for the restaurant.
Hey, Gibbie, this is Ruben from Spectrum News. You talked about the importance of face coverings earlier. I'm not sure if anyone from CMPD is there, but I'm curious, as you know, some members of the department decided not to wear coverings in order to improve interactions with some of the protesters a few weeks ago. Do we have an updated number of how many officers have COVID and the impact that not having face coverings had? Thank you.
We don't have anyone here from CMPD today, but the reports are at this point we have not seen any additional cases among our CMPD staff in the county since the protests began.
Hi, this is Christy O'Connor from WBTV. My question's for Dina in regards to the money that's being used to provide masks to those who don't have access. where can people get those and when will they be distributed?
So we're still doing the planning around that. We just got the approval on Tuesday to spend that money, so we have to procure them first and then figure out the most effective way to distribute those. We don't have that plan in place yet, but as soon as we do, we will make sure that we push that out widely so people will be able to access them. We are going to be looking at potentially some of our more grassroots nonprofits as we think some good ways to get those out into the community. But again, we're continuing to work through that to see the most effective way to have those distributed.
Gibbie, this is Brett Jensen again. I'm curious on jumping in on the restaurant thing again. I'm curious, since you guys have the names of every restaurant where an employee tests positive, would you guys considering releasing the names of the restaurants in case people have been there, so they maybe need to get tested?
What we do in situations like that is we assess the situation. It's like any other communicable disease that when we're working with restaurants, if we believe there is a public health need to release that information, if we believe that there's been widespread, the potential for widespread exposure, we will do that. It will not be a routine thing that we do, though, if it's not necessary.
Hi, Gibbie. This is Hannah Smith with The Observer. You've recommended that people who have been to protests or mass gatherings get tested. Is this something that people who have been out to restaurants or breweries and things like that without masks should be getting tested regularly?
Well, what we are saying at this point is that anyone that has been to a a mass gathering of any sort, whether it's a protest, should be tested. Yes.
Gibbie, this is Robin with Fox 46 again. Two questions. One, a follow-up on the restaurants. Why are you not recommending that they close if they have a COVID case? And then on the jail side of things, since I believe there have been 2 positive cases in Mecklenburg County Jail, is there a plan to test all of the inmates? And if not, why not?
So in regards to the restaurants, again, we assess each situation individually. If there is evidence of widespread exposure, if they've not been doing the things that they need to do, if the staff have not been wearing masks, if there hasn't been social distancing, then we might make a recommendation that they consider. But at this point in time, we do not have the authority to close them for that reason. So we would make recommendations based on the specific situation in that restaurant. In terms of the jail, I do know that the sheriff is working to test the appropriate individuals within the jail. They're doing some widespread testing within the pods where these individuals were and are isolating and quarantining those folks appropriately.
This is Hannah again.
Eric with the Business Journal
So
again.
can you say, do you consider restaurants or breweries mass gatherings?
I think it would depend on the situation. I have seen some pictures on social media where I would say yes. If they are appropriately social distancing and people are wearing masks, then probably not.
Maybe this is Eric Spanberg again for the Business Journal. I'm curious, yesterday the governor was praising retailers who require masks for shoppers to come into their stores. Would you like to see retailers in Mecklenburg County do that?
I think there's some benefit to doing that, and I do believe that it presents opportunity for us to make sure that more people are wearing masks in our county, and that more people are protected.
Hi, Gibbie. This is Christy O'Connor from WBTV. If the county decides to implement a mask requirement, would there be exceptions at restaurants and breweries?
I do believe anything that we would put out would have exceptions to it. There are some reasons why you cannot wear masks. It's a little challenging to eat and drink when you've got a mask on, unless you're taking it off and on and off and on. And there's reason to believe that that's not terribly effective either, for a number of different reasons. So there would be some exceptions that would go with any requirement that we might put in place.
Hey, Gibbie, it's Allison again from the Charlotte Observer. Could you talk about construction site outbreaks, if you're aware of how many outbreaks are there currently at construction sites in Mecklenburg County, and what new oversight is being provided to those job sites?
So we work with those job sites when we see more than one case at those sites. And that fits into the cluster definition that we've received from the state. We have not seen a significant increase in those sites recently, and I think part of that is because we've been working with them to educate them on the things that they need to do, although we do understand that some of those sites, I heard about one yesterday where no one was wearing a mask, so we still have work to do around that.
Jensen again. This is for Dina. Dina, it seems like a foregone conclusion that next week the governor is going to issue some kind of mask order. I know you guys are talking about receiving masks and everything else. Have you guys already started talking about how you're going to devise ways to get these to the lesser communities?
Yeah, that's the plan we're trying to put in place now. We're going to try to work with our grassroots nonprofit organizations and use them as a mechanism to try to get these out. But again, we're still trying to put that plan together to make sure that we do that in the most effective way possible. But we want to make sure that we can make them available to those that don't have them available at this point. And we'll let you know more. This is our last question, okay, for Gibbie?
Gibbie, this is Ruben again. What's the hospitalization rate looking like now in the county, and how comfortable are you with that going forward as the cases continue to go up so much?
Well, right now, our hospitals are fuller than they were because they have opened back up for individuals who postponed procedures or were not actually getting the care that they needed because they were concerned about COVID. So they are seeing increases in their rates. I think we're still in the 70s to 80% at this point in time. But we do know, in working with both hospital systems, that they have the opportunity to reduce that percentage fairly quickly. Their plans are in place. They also have the ability to scale up. So we are watching with them these rates to make sure that they're not getting into a red zone where we need to be of concern. But they're adjusting every day to those rates based on what they're seeing coming in through the doors, and we're comfortable with where we are right now. That was the last question. Thank you very much. Y'all have a great weekend.